Hi, I'm Samira, and today I'll be talking about Down syndrome, dyslexia, and epilepsy. Down syndrome. Down syndrome is named for the English physician who first described it in 1866. It took around a century for scientists to determine it was caused by possessing an extra copy of all or part of the 21st chromosome. Hence, people with this syndrome have 3 copies of this genetic material instead of 2. Sometimes the extra copy or trisomy does not occur in every cell, producing what's known as mosaicism. There is no clear cause for Down syndrome. Maternal age is a major risk factor for Down syndrome, as mothers older than 40 are 8.5 times more likely to have a child with Down syndrome than mothers aged 20 to 24. Additionally, older paternal age has also been linked to higher incidence of Down syndrome. Since late 2011, fetuses can be screened for Down syndrome using the mother's blood. However, due to the risk of the test procedures, only older mothers were screened. Now the new blood test poses no risk to the baby, so it can also be used for younger mothers, whose chance of having a child with Down syndrome is quite small. Children born with Down syndrome have distinctive facial features, including a flattened face and a bridge of the nose, eyes that slant upward, and small ears. They also have small hands and feet, short stature, and poor muscle tone as well. The intellectual abilities are typically low to moderate. Other symptoms include hearing loss and heart defects, and virtually everyone born with Down syndrome will develop early onset Alzheimer's disease, often in their 40s or 50s. This is due to chromosome 21 containing the gene that encodes amyloid precursor protein, APP, an Alzheimer's disease risk factor, and possessing an extra copy of this gene might cause the early onset of this fatal disease. People with mosaic Down syndrome have milder symptoms and are more likely to live past 50. There is no real treatment for Down syndrome, nor any clear explanation of what occurs in the brain. Poor connections among nerve cells in the hippocampus, the part of the brain involved in memory, and the first brain area affected by Alzheimer's disease are believed to be a key factor in brain or intellectual differences in Down syndrome. Dysfunction in the mitochondria, the cell's power plant, might also play a role in development of related disorders that involve energy metabolism, such as diabetes and Alzheimer's. Scientists have grown stem cells from fetuses. These models are being used to test the changes and cellular problems that occur with the tripling of the 21st chromosome, in hopes of eventually finding a treatment. Dyslexia. Dyslexia is the most common and the best studied of the learning disabilities, as it affects as many as 15 to 20% of all Americans. People with dyslexia have a pronounced difficulty with reading. Brain imaging studies indicate that areas of the brain can be less well connected in people with dyslexia. One of these areas is a region on the left side of the brain called the word form area, which is involved in the recognition of printed letters and words. People with dyslexia also show less brain activity in the left occipital-temporal cortex, which is considered essential for skilled reading. It is believed that the brain differences are present before the reading and language difficulties become apparent. People with dyslexia tend to rely more on the right side of the brain. Genetic analysis have shown that a handful of genes affect the migration of brain cells during development, leading to differences in brain circuitry. Dyslexia runs in families, with roughly half of dyslexics sharing the condition with a close relative. Dyslexia is usually diagnosed in elementary school when a child is slow to read or struggling with reading. Although these skills can improve, dyslexia persists lifelong. Symptoms include trouble with pronunciation, lack of fluency, difficulty retrieving words, poor spelling, and hesitancy in speaking. People with dyslexia might need more time to respond orally to a question and might read slower than their peers. Treatment for dyslexia involves behavioral and educational intervention, especially exercises like breaking words down into sounds and linking the sounds to specific letter patterns. The rapid automatic naming and the ability to recognize and work with the sounds of language are often impaired in people with dyslexia. Both skills can be used to predict the later reading skills of young children. Research suggests that treatments targeting phonology, as well as multiple levels of language skills, show the greatest promise. Epilepsy. If someone has 2 or more seizures that cannot be explained by a temporary underlying medical condition, such as high fever or low blood sugar, the medical diagnosis will be epilepsy. Seizures result from irregular activities in brain cells that can last 5 or more minutes at a time and can look like staring spells, or cause people to collapse, shake, and become unaware of what is going on around them. EEGs are used to distinguish between different types of epilepsy and determine whether that is the true cause of the seizure or if a different medical condition caused it. Seizures are classified by where they occur in the brain. Generalized seizures affect both sides of the brain. They include absence or petit mal seizures, which can cause rapid blinking or a few seconds of staring into space, and tonic-clonic or grand mal seizures, which can make someone fall, have muscle spasms, cry out, and/or lose consciousness. Focal or partial seizures are localized to one area of the brain. A simple focal seizure can cause twitching or a change in sensation, triggering strange smells or tastes. Complex focal seizures can leave a person confused and unable to answer questions or follow directions. A person can also have so-called secondary generalized seizures, which begin in one part of the brain, but spread to become generalized seizures. In some patients with severe epilepsy, multiple types of seizures can occur at the same time. Epilepsy has many possible causes and thus is considered a spectrum rather than a single disorder. Causes include premature birth, brain trauma, and abnormal development due to genetic factors. Attributes of epilepsy patients such as head size, movement disorders, and family history suggest that genetics is involved. Seizures can also accompany or cause intellectual psychiatric problems. Treatments for epilepsy are directed towards controlling seizures with medication or diet. For most patients, a single medication is enough to control seizures. About half of epilepsy patients, particularly those with generalized epilepsy, can reduce their seizures by eating a ketogenic diet, which relies heavily on high-fat, low-carbohydrate foods, although it is unclear why this diet is effective. For severe cases, doctors might recommend surgery to remove or inactivate the seizure-initiating part of the brain. If one side of the brain triggers seizures on the other side, surgeons may perform split brain surgery, cutting the corpus callosum, a thick band of white matter that connects the two sides of the brain. Once their seizures are controlled, people with epilepsy can resume their normal lives. This concludes the lecture on Down syndrome, dyslexia, and epilepsy. Thanks for listening.